Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Hello, everybody. Again, we're here with someone who is so smart, so talented, and quite attractive. Of course, there's nothing better than that when you're talking to someone. And of course, her name is Cynthia Meacham. You have heard her before. She is really the local independent agent with Senior Services North America. So welcome to our show, Cynthia.
Thank you for having me, Anita.
You must be very, very good with older adults because your responsibilities are enormous.
Yes.
And I'm sure they ask you funny questions that, and you're so nice, you would never, be anything but understanding.
Correct.
Right. So let's start off with something. We know that we've been using the word boomers for a long time because that's what we changed our magazine's name. It used to be Senior Life and Boomer Times. Now it's Boomer Times because everyone wants to be a boomer. What do you think about the word boomer? What does that mean to you?
Boomers are anyone born between 1946 and 1964. Down here, they equate to over 11,000 people each day turning 65. So that equals thousands of people each month. So it's like a senior haven down here, per se, down in South Florida, because we just have so many seniors, aging into 65.
That's true.
Yeah.
But you see that people now are working longer. I mean, is that what you're running into when you're talking to these people?
For the most part, they're still retiring at 65. I still find more people retiring at 65, but I am now seeing a trend where people are tending to work, a little bit longer just due to the rising cost, of living down here.
Right. So how do we focus in on the senior Medicare market? I mean, explain that to people. Someone who's just turned 65, let's say, they don't even have an idea of what that is.
So right when you turn 65, as long as you've been working 10 years or 40 quarters, you automatically get enrolled into Medicare, which is usually Part A, which is going to cover your hospital. In addition, if you want to get Part B, you usually have to call into Medicare and opt in to start collecting, and receiving your Part B on your Medicare. And we recommend that you do that about 3 months before you actually turn 65, so it gives them enough time to give you your cards and everything, and you'll have everything once your birth month hits.
That's excellent advice, and I'm going to at this point give you the phone number because don't go on Google and try to figure this out. We are so fortunate to have the Senior Services North America with Cynthia Meacham, and she will explain it to you. You don't have to have any questions about. Google's not going to answer you like Cynthia is.
Or it's going to make your head spin, and you're not going to really know what's going on because it is a little bit.
That's true. So let me give you a phone number. It's 954-802-0738. And if you call that number, and I'll be giving you that number throughout this interview, because it's funny, Cynthia, nowadays, where I used to be able to make a phone call, this isn't working, I want to know about this, even reservations. All you get is the internet. And a lot of people don't know what to do with that.
I know you can't call a reservation. You have to go online and go to like Open Table or whatnot in order to get in where you need. I know. And that's what makes us so great is that when anybody has a problem, I have them call me directly. And I can usually, get to the bottom of it. So they're not kind of running around, getting the runaround, calling here, calling there. They can just literally call me. And as you know, Anita, I pick up my phone and I'd be more than happy to help you.
Well, when we talk about A and B, we're used to that. We know what it is. Will you explain that a little bit in more detail? What when they get Medicare A, they get Medicare B, and then what about supplemental? I mean, these are words that we know, but they don't.
Yeah, so like I was saying, when you turn 65, as long as you or your spouse have worked 10 years or 40 quarters, you are eligible for Medicare. Part A covers your hospital. Part B is going to cover your doctors. But that's just very basic coverage, as you know. A catastrophic hospital stay, or for heaven forbid, an expensive medical procedure could really put somebody over. And also with original Medicare, a lot of people don't realize is their prescription drugs are not covered under original Medicare. And as you and I both know, those costs are just rising every single day, and there's no sign of the prescription drugs, coming down. So what we have to do is, kind of take a look at everything, see what the client is really looking for. Do they want to prepay for their health? Do they want to pay as they go? What's most important to them? And then I kind of break it down and do it that way. But the most important is your Part A's and your Part B's, that's your Medicare. Then you need something to kind of supplement that so you're not stuck with that 20%. And then of course you need prescription drug coverage.
Exactly. And what really is the difference in going to an HMO, and are all HMO what they call Advantage plans? Will you explain that too?
So Advantage plans are also PPOs as well. And they're HMOs or PPOs. An Advantage plan is you pay as you go. For the most part, there isn't, depending on the area, there isn't a premium, or if there is, it's not very high. That's not like your Medicare supplement premiums. And you're going to pay as you go. You're going to pay a little bit when you go see a specialist. You'll pay for the first couple days in the hospital. But then there's also a cap. So they cap you out so you're not spending, thousands either as you go along. They'll cap your cost as well. With the Medicare supplement, you're going to pay your monthly, whether you use it or not, and you're going to have coverage no matter where you go or what you need to get done. So it really depends on the client, and do they travel? What are their health costs right now? Do they see doctors in different states? Are they traveling, 6 months here or 6 months in New York? It really is a thorough process that I need to take with each client because everyone is so unique.
And these are the questions that you know to ask, but they wouldn't know to even respond to if no one asked them, right?
That's correct. And a lot of times I meet with people who are in a plan and they're in the wrong plan because their friend told them about this plan, but they didn't thoroughly check to make sure that, those benefits were right for them.
Exactly.
So, really,
do you have like a whole checklist? I'm sure you do. When someone calls you and you go down this list, you probably dream of it at night.
I love the checklist because by the time I'm done, I can present it and we can see all your doctors, all your hospitals, for heaven bids, if there's any clinics that you go to or outpatient facilities that you go to. And then of course your medicines. I need to see what medicines you're on, and then I need to see what company is going to cover that medication at the most, affordable cost for you, because they're also
right. Yeah, that's very, very good. I'm really happy that you have been able to do this with us, because I used to get the phone calls. I mean, here I am, I'm, publisher of a magazine, I'm a gerontologist, but I don't really understand any of that. And of course, every month, since I'm a Medicare, I get something from Medicare, ARA, whatever it is. And I look at it and it's like, ho hum. Well, what does that mean? And why would I do that? So what you're saying that now, when they have it through you, they can get these and then they can call you and ask the questions, because you don't want to have to try to call the government. Don't you? Just that lots of love.
Yeah, that gets a little complicated and very timely.
Right. And so you're able to know all this.
Yes, I'm able to help them through it.
Yeah, and you do. And my guest, as I said before, Cynthia Meacham, and she is the local representative. She actually, the company that she represents is Senior Services North America, and they are so smart. The owner is, and we're going to talk about this at some point, that he's going to be doing a health and wealth series. I did attend one, and I was blown away by it. He is so smart, and he really knows what he's talking about, and there's no pressure, and it's free to get on it. So I know we'll talk about that at another point, because it's going to go into your ad so that people will be able to add in Boomer Times, they'll be able to see it. And I hope you don't miss it, and I hope you'll get your friends to tune in also, because he's really a great speaker, but he's very smart, and I really did enjoy that.
Yeah,
So,
he's great. And what Senior Services has done is they've really plugged into exactly what the seniors are looking for. So we can be your one-stop shop for your Medicare, your health, your wealth, for everything. So you just have one person to go to rather than calling all these different companies. And, like we just talked about, your time alone, just being on hold and getting all these answers. So it's great that you just have one resource now to give them a call, and we'll help with everything that the senior needs, health and wealth wise.
well, let's say that someone is 65 or even 70 and they're, I don't know what age it changes, but they're working and they actually have coverage. What happens now? They're not on Medicare. And I don't know. How does that all work?
So when they're working for a company, it really depends on the company. And I always say, talk with your HR, to find out. But what it really comes down to is what's the premium? What's the deductible? Will the company allow you to work when you are eligible for Medicare? Some of them want you off their health plan and on to Medicare. Other companies will allow you to stay on. And another thing is that I always ask, is there anybody else on the policy with you? Because if you're on a group policy with your wife and you get off and you go on to Medicare, well, what's your wife going to do? So those are all questions to be, asked.
Absolutely. Oh, right. Can you picture that one?
No, I need to make sure that, because that would be the worst. And then their spouse is stuck until they're 65 without, unless they get on Obamacare or whatnot. So that's also, and then if they have dependents, sometimes 65, you still have children that are on your policy. So all of that needs to be discussed before we can, switch you off of there.
Well, it sounds to me like they wouldn't. Why should they even do it? You're thinking that because if they go on a Medicare Advantage, there's no payment. Why would they not want to do that?
Correct. Most of the time they do. The only time they don't is when they have a dependent on their plan and they can't get off. But for the most part, the Medicare Advantage plans work very similar to what they already have with their group health. So they're okay with this small copay to see a specialist and a small out-of-pocket to go to the hospital. So most of the time they choose the Medicare Advantage plans because it just makes more sense. Healthcare is very expensive. 60 to 64, those premiums are sky high. So it saves them a lot of money to switch, and it just makes sense for them.
Mm-hmm. Have you ever found a couple who one wants to be with this particular Medicare plan and another wants a different one?
Absolutely. A lot of times I have a client that Hannah comes to my mind. Her husband was 20 years older, so he was with a company forever and he really wanted her to go with that company, but it just didn't make sense for her. Her doctors were on another company. So sometimes, it doesn't make sense for them to be on the same plan, and that's totally okay. You can be on 2 different Medicare plans and still under the same household, and that's totally fine.
Oh, good. Okay. Because, all right. So it's just really, most of the time it's the doctor that makes a difference. Why don't we go into that a little bit? They're going to ask you, well, why should I go on this plan? And what are the different things you're going to tell them?
Well, all of your doctors take this plan. The hospital that you like, Broward or Holy Cross, they're in network on here. They do, they take you for all of a lot of people go to facilities for different things. So I need to make sure their facilities are on. So when I have a plan, all of that's checked off. Their doctors are on, their hospitals are on, it's their medicines are being covered at the most comprehensive for them, and their out of pocket is going to be the least. That's what I'm trying to do, is save everybody money and make sure that you have adequate coverage.
So Cynthia, how do you become so educated? You must have a source.
Lots of years of experience. And then of course, being contracted with all these different companies, I have built relationships with the regional reps so I can make sure that I know everything that's going on, all the perks in each company. And every year I have to get recertified and, do my due diligence and make sure that all my training's done. And it's a lot of work, but at the time, I'm so unbiased when I meet with somebody because I am able to represent all of the Medicare Advantage, all the Medicare Supplement, and I have all of your major carriers in the area. So it's a little bit for me, but it's great for you guys.
Yeah. Over the last 5 years, things have changed though. I think they've added a lot of other things.
Every year keeps getting better and better. Every year they add more benefits to the Medicare Advantage side. Every year the prescription drugs I see, are starting to get covered a little bit better. And the copays seem to keep going down. So it's a great thing.
Fantastic. Right. And then as new things come on, just like for years, they never had the, get what it's called, silver
Sneakers.
They never had. I mean, they used to have places you could go for their senior, seniors would go and have an event, but then all of a sudden they were able to go and have like a gym that they could go to and not pay for it.
That's correct. Yes. Silver Sneakers is in a lot of the gyms down here. So they like to go and they like to take their classes or just kind of walk the track around on the inside or whatnot. And a lot of the gyms now are even catering to the seniors, and they have senior workout classes or whatnot. So those are great. And they just kind of keep you moving and use light weights or whatnot. And it's a great thing,
Well, yeah. About how many, not exactly, how many different HMO Advantage plans are there out there?
There's about 41 different companies.
Wait, 41?
Yeah, if you go to Medicare.gov and you put in your zip code, you will pull up just about 41 different plans, and your head will be spinning. So stop right there, call me,
right?
And let me help you out, because it is very confusing at first. Because which one do you go with? You don't know.
41 plans. I can't even believe that. That's like, I mean, I thought you were going to tell me maybe 10.
Yeah, no, there's a lot of different options out there for you.
Okay, so we
talked about in our last webinar that we had, those chronic plans that are out there for people with chronic conditions or diabetes,
right.
Medicare, Medicaid. So there's a lot of different options for you. And if you don't know the differences, it's going to make your head spin. So that's why it's good to call somebody to kind of walk you through. And our services are free to you. So it just makes sense to have our help.
I bet I don't know how old you are. You're pretty young, but I'll bet a lot of people your age wish there was something like this for them, for all of you, because it's as you said, the insurance is very expensive.
Very, very expensive. I mean, my family, it's like $1,600 we're paying a month for a family of 4, and it's not even like great. So
that is interesting. So it must. So when you get people involved, you take a deep breath and think, oh, I wish I.
Yeah, I got a little bit longer, but yeah, I always even congratulate people when they turn 65, because they're going to be taken care of now for their health needs much more than they were before.
Yes, I realize that. Oh, and then let me just give your phone number out again. It's 802-0738. And I'll do that again, 954-802-0738. So this phone call could save your life, because if you get the wrong company, if you do, you'd be surprised when you say, well, I need to have a doctor for this. Well, we don't have that. Or I need this, but we don't have that. Well, no one told me because you didn't ask Cynthia. Right. That's the problem, right?
That's absolutely the wrong choice in health plan could cost you a lot. So it's definitely a very, very, very important thing. And you need to make sure that you're on the right one, because then you get in lockout periods where you're stuck until open enrollment. So you don't want to be, for a whole year paying high, drug costs and high copays to see the doctors and whatnot. So you need to make sure that all that's covered.
Yeah, you just brought up a very good point about it. So open enrollment, somebody has no idea what that means.
Okay, so AEP is annual election period, and it runs from October 15th till December 7th. And that's when they can make as many changes as they want. And they can change their new plan for the upcoming year. So this year will be for January 2022.
All right. And then there are some that I heard that are, well, I don't know what the designation is, but they're going all year.
Correct. So those
5-star or something?
Yeah, those are your 5-star plans. If you're in a 5-star plan, you can enroll throughout the year. Care Plus down here, which is owned by Humana, they are a 5-star, so you're allowed to enroll in them throughout the year. And then, of course, if you have any kind of chronic condition, you are allowed to enroll throughout the year. And Medicaid, Medicare, those are the few things that you can actually, if you need changes for.
Can you go, and we haven't done this before, but how do you know if someone is on Medicaid?
Because they will have a gold card that gives them a their number for Medicaid. But then we also, depending on what carrier they go with, I call, let's say it's Humana, I'll call into Humana with their Medicaid number, and they'll be able to tell me exactly what plan for them, because some people have full Medicare, some people have partial Medicare, depending on their income. But yeah, the insurance companies then are able to have their information based on their Medicaid number.
And as you were talking, I was thinking, if I, as just an individual, tried to make those calls, lots of luck. You know, I mean, you're going to wait on the phone. You're not going to get someone, but you have the name and you've been working with people in all these companies. And when Cynthia calls, they answer, I'm sure. Right?
They do. They're all great. Everyone, you know, usually answers. And if they don't, they call me right back. So I've had great.
Yeah, well, it's the way you are. It comes out on the video that you're doing now. I mean, you have a great personality. You are very knowledgeable. And that is really an important thing in this business. So Cynthia Meacham, Meacham, and she's the local, a local representative, of course, with Senior Services North America. And the owner, as I said, is going to do something very special in July for us. He's going to have a wonderful health and wealth series, and you'll see it in the ad that's coming out in our July issue. Be sure to attend. I'm really going to have to send out a note to all our mailing list and all, because I think it's, you know, to have this free, to just get on there for 30 minutes and have someone like that talk. And he's an extraordinary speaker. I mean, he really is smart. Yeah, he is. And so I think that's a real plus for you. How long have you been working with them, Cynthia?
This is year 5, I believe.
No kidding. Well, yeah. So, you know, that's why, I mean, you're so well trained.
Yeah, I'm not going anywhere.
No, you know so much. It's great. The other thing, though, you know, I have a few more questions that I want to ask you, but what really is what's the value of being on one Medicare? You know, we've talked about it, but people will talk about it and say, well, I'm with this company. Oh, well, I'm this company. And the only value I've heard from you really is the doctor. Are there other values?
Of course. Some companies offer better dental than other companies. So people that are looking to get an implant per se, there is 2 companies out there that'll cover an implant. So if I do that, that's a like, okay, let me go look at that one for you, because that would be a huge, I mean, a dental implant's $5,000. So if I can get a company to cover that for you, that's a huge savings. A lot of people are like their vision. They're very concerned about, you know, what kind of vision they're going to be getting. Dental, vision, hearing are always things that if somebody has hearing aids, as you know, those are expensive. So they need a plan that's going to be able to get them new hearing aids covered every year or 2. So those are things that I have.
Do all plans cover cataract surgery?
Yes, that's covered through Medicare. So yeah, you have your surgery covered, and then a pair of glasses after. Covered. So
what the difference is that there are some that will cover hearing aids, and they will cover you know, things like that like dental, which you said, which haven't really always been covered. Dental, I've never understood that Medicare, why don't they think that seniors need to have good dental work?
They should incorporate just basic dental coverage, even, you know, cleanings and, you know, I'm right here or there in original Medicare. They absolutely should. And maybe, you know, fingers crossed that they will in a couple of years, because that is very important. And, you know, I'm starting to find out that the more I read, a lot of our health has to do with our teeth. So if you have a bad tooth, you know, in there, all that bacteria and all that you're swallowing into your body, and it's a whole mess. So dental is very important. They absolutely should cover that under original Medicare.
And you said that the gym, like Silver Sneakers, pretty much they all have gotten into that.
Yes.
But that's what you're going to ask. Now, how about people who have you know, operations coming up? Would that make a difference? I guess it's the doctor that they know that they want to go to a specific surgeon. Do they find that out from you?
The doctor, I would find out who their orthopedic surgeon is or whatnot, and then what facility that they operate at. like to find out that as well, so I can double check and make sure that that's covered in the plan as well.
So the facilities are very important, the hospitals and the plans. If someone's in South Florida and they live, in Miami-Dade, are you handling that also?
Sure. I take the whole state of Florida, no matter where you are,
The whole state?
I can handle you. Yeah. If you're in Tallahassee, it may just be over the phone. I may not be able to meet with you in person, but yes, I can take the whole state.
So if someone is on a Medicare plan, a big plan, I guess the Advantage plan, and they live in Miami, let's say, and now they have to travel to Tallahassee, something happens there. Does that plan still take care of them, or is it only out of state that it doesn't take care of them?
Well, if they have a PPO with the Medicare Advantage, you can have a PPO with the Medicare Advantage, and yeah, they will be covered. Now, if they have an HMO and something happens, an emergency, and they're in Tallahassee, that's covered, of course. Anything emergency is going to be covered. But if you're traveling and you just want to see a doctor, that's why I always ask, how often do you travel? Do you have another residence somewhere? Because if they do, I put in that zip code and make sure that they have coverage where they are as well. And there's a bunch of doctors and hospitals that cover that area as well.
See, people don't really, that's really unusual. It's only since I think I've been talking to you that I learned that. I mean, I've learned so much from you.
Oh, that
You've
makes
had,
me
I
happy.
don't know, maybe 6 webinars and all that, but you really are so knowledgeable, and it's such a pleasure to know what you do. So if someone is moving though out of state and they say this to you, what do you advise them to do? Do you have a place that they can call, that somebody like you?
Senior services, because we have agents throughout the entire nation.
Oh, you do?
Yeah.
That's why North America, that's why it's called of North America.
Yes. So I would just give Joe a call and get the agent in whatever area they're at and refer them over. That they're going to be very well taken care of.
Oh, no, wait, we haven't talked about this before. I think that's really important. So if someone's here, but they're planning on moving to another, not another state, because you can handle this.
Okay.
But if they're going to move to Georgia or to Colorado, then you will help them find someone that will answer their questions.
Absolutely. Yes. That's the beauty of senior services in North America, is we have agents throughout the nation. We're all on the same webinars. We all are just as knowledgeable as the next one, as you know, because of our boss. So yeah. He's great. So yeah, we can definitely find you somebody in that state.
Yeah, he really did something. He's not that old. I mean, he's not, I don't think he's a senior himself, but he sure does know what's going on. Number's 954-802-0738. And I think we're being told we're out of time. It went so fast, but you are such a pleasure to talk to. And I've always learned something from every interview we do.
That makes
Cynthia.
me so happy. That makes me so happy. It's always a pleasure to talk with you, Anita.
Thank you so much, Cynthia. Okay, bye everybody. Just call Cynthia. She'll help you.
Yeah.
Don't go to Google. That's right. Call Cynthia. Okay, we'll be back another time. Bye.
Bye-bye.